Medicaid. And the fastest growing component of Medicaid is not poor people rushing on Medicaid. It's actually middle class folks who are spending down and spending that money on long-term nursing home care. And the second thing is prescription drug coverage. If we were able to take prescription drug coverage and provide a decent federal plan, that would free up resources at the state level to provide coverage for the uninsured. If we were able to provide a long-term nursing home care program under Medicare, that would free up resources at the state level to further broaden the kinds of coverage that we provide to the uninsured at the state level. We can deliver on the program that Jim Duffin just talked about if the federal government takes care of business. And so the challenge is, how do we get the federal government to take care of its business? I happen to be a proponent of a single-payer universal health care plan. I see no reason why the United States of America, the wealthiest country in the history of the world, spending 14% of its gross national product on health care, cannot provide basic health insurance to everybody. And that's what Jim's talking about when he says everybody in, nobody out. A single-payer health care plan, universal health care plan. That's what I'd like to see. But as all of you know, we may not get there immediately, because first we've got to take back the White House, and we've got to take back the Senate, and we've got to take back the House. In the meantime, what we can do is at least stand up to the Republicans when they try to pull the okie doke. And a great example is this latest Medicare prescription drug benefit. I don't know if anybody has looked at the plans that passed out of the House and the Senate, but if you look at those, see, even the kid is crying. He's not even worried about Medicare yet, he's already upset. You've got a situation here where not only is this basically a program that will do nothing to control costs and will do nothing to take money away from the big insurance companies and the drug companies, because it does nothing to reform that system. It sets up a privatized system that will allow seniors to get dropped from a plan. And it's got a gap in coverage in addition to high deductibles and high premiums. It's got a gap in coverage